It's Mari McInerney from Croaky here and Mildura at the SARA conference, which is Rural and Remote Allied Health. And I'm speaking with two of the delegates here who will introduce themselves, please.
Hello, I'm Zoe. I'm a physiotherapist from Forbes, New South Wales.
And my name's Matiese, and I'm also a physiotherapist from Forbes, New South Wales.
And you're both in the same practice there?
We are, yes. We own our own practice, Rise Physiotherapy Group.
Fantastic. And what's brought you here?
We're here to learn a bit more on how to make our practice better for rural people and how to bring other allied health staff to our area.
Same?
Yeah, same. Yeah, so we were lucky enough to be sponsored by Three Rivers to come to this conference, which is really good, supporting the rural community, and we really just want to increase the service availability for all of our clients.
So what is that availability like? What are the issues that you face there to give good services?
A lot of our families are having to travel long distances to get services. So, for instance, some families are going to Sydney, which is 5.5 hours away, just to seek services for their children or for themselves. So we'd love to bring those services to our area so they don't have to travel as far.
Yeah, I even have clients that are weekly travelling to a nearby town that's 1.5 hours away just for weekly services. So that is a really big demand on the families and takes time away from schooling and things for our children. So it can be really tricky schooling.
Financial costs.
Yeah.
Health costs?
Yeah. It is very demanding.
Yeah, and a lot of our clients don't have the capacity to do that as well, and so their health comes at a detriment to that, and their progress is also
because they can't
not
access
quite
it.
where we can get it because they don't have the access to services.
And could you give an example where that might happen?
Yeah, so for a lot of people in Forbes, things like psychology, there's not many psychologists in the town. So we have we've got like a big paediatric base that need those services, and so they are having to travel, 1.5 hours.
If not 5 hours.
Yeah, if not 5 hours, especially for a lot of ours who are wanting in-depth assessments and things like that was all having to be done in Sydney to get diagnoses and things. So a lot of families are going without for a long time, which is decreasing their health overall.
And solutions to that? Can we have that level of specialisation everywhere?
Absolutely, yeah. We just need the people to come to the rural areas and want to be there. So hopefully we can get some tips today on how to recruit people and get them to stay and love it like we do.
I didn't think to ask, are you locals there?
I grew up in Dubbo, so that's 1.5 hours from Forbes.
And I'm pretty well local. I grew up in Parks, which is only 1/2 hour away from Forbes, so very local.
So all from rural settings.
And so what made you both decide to train and also then to stay in the area? Because that's the big problem, isn't it? People go off to uni and stay away.
And stay in those metro areas. Yeah, that's right. Both of us have a real passion for rural health and always have as young children growing up. We wanted to give back to our communities, and we could see the need for it because there aren't the services in our areas. So, we wanted to give back.
Yeah, I also was fortunate enough to study rurally, regionally. I studied at Orange, New South Wales, which really gave me an appreciation for the rural health setting and just built that passion a little bit more for me to stay in the area. And fortunately enough, Zoe and I actually found partners in the area, so we are there well and truly now as a farming family.
Okay, so if you had a message for the minister?
Try and help us get allied health staff to the rural areas. We need your help.
Just advocating for rural health. We find that there's sometimes a stigma around coming rurally, and a lot of people will use it as a stepping stone to get back to the city, but we really want to reduce that stigma a little bit and just get quality staff to the areas.
Quality healthcare.
Thank you both very much.
You're
Have a great
welcome.
couple of days.
Thank you, you too.